Hello friends, I am Dr. Jaydev Panchwagh, Neurosurgeon and Spine Specialist at the Pune Neurospine Center. In today's spine podcast, I would like to discuss a very important topic related to the spine. I think everyone should know about this problem, not only because it is very common, but also because it is very well treatable with surgery if diagnosed early. This condition that I am talking about is called neurogenic claudication, and it happens because of the problem called as lumbar canal stenosis. And this is a very common symptom of spine disease. As I said before, it needs to be identified early for correct and timely treatment. And the secret of early diagnosis lies in the patient's knowledge about the symptoms of this problem. So what exactly happens during neurogenic claudication? So when these symptoms initially occur, they occur while walking. A patient will typically describe the problem as follows. They would say that when I start walking, for the first few meters I am absolutely normal, but slowly my thighs and calves become heavy. Even the area of my bums starts hurting. If I continue walking further, numbness and heaviness spreads in the thighs and legs. Then I start limping with pain, and then I have to stop. At this point in time, sometimes my legs buckle and there is a loss of power in both the legs. So here I am literally forced to stop walking and take rest. If I don't stop, I fear falling down. As the problem increases in intensity, and it happens with time, even standing for extended periods of time is impossible. The typical symptoms I hear in our spine clinic is, "Doctor, I am not able to stand while cooking. I have to sit even before the tea is ready." Or they would say, "I have stopped going to the malls because I cannot stand for long periods of time. Sometimes I have to sit while the purchase is being made." Or they would say, "Doctor, I dread going to the bank. I cannot imagine standing in even a short line." So in such situations, these patients have to sit and rest. On resting for some time, the symptoms gradually improve and they can then walk for some more distance. As the days and months pass, this distance for which they can walk without pain initially goes on reducing. If the problem still is not treated, the patient could become chair-bound or bedridden. So to summarize, in the beginning, whilst walking, patients may not notice any discomfort. After some time of walking, the back of the thighs, buttocks, and especially the calves start to feel heavy and tight and weak. Tingling and numbness starts in those areas, which by the way could spread to the genitals or anal regions. Continuing to walk becomes increasingly difficult, often forcing the person to stop. In advanced cases, this happens even while just standing for some time. Now, interestingly, bending forwards while walking may temporarily alleviate these symptoms. After resting or sitting, the symptoms gradually subside, allowing the individuals to walk a short distance again. While describing these symptoms, the typical words or phrases used by the patients are heaviness, numbness, weakness in legs, unsteadiness, tingling, or the numbness in thighs, legs, and sensitive areas. Neurogenic claudication symptoms become more common with advancing age, and if accurately diagnosed, surgery can effectively treat this condition. This is very significant because many older individuals often attribute these symptoms to aging and accept them as unavoidable, ignoring their underlying cause. Here they are risking becoming dependent on the family members, and for the reason which, if diagnosed correctly, is eminently treatable. And this actually is the message that we should not forget. In other videos, I have discussed about the investigations and treatment of neurogenic claudication. I have given the links in the description. If you have liked this video, please share it with others. Thank you very much.